Hi, Dr. Sean Caesar here. I'm pleased to introduce you to our Cancer Treatment Center here in Winnipeg, Manitoba, Canada. Patients from all over North America come in for treatments here at the center, and we provide advanced naturopathic therapies for all of our cancer patients. Our cancer patients can be of any cancer type, from breast to lung to brain to colorectal cancer and all the other cancers. Any stage, any grade, we treat. And our extensive research and our extensive modalities help patients to live longer and improve quality of life for the majority of patients. The time spent here is very, very, very important to get those regimens so that we accomplish these goals. And patients work with us to achieve what they want to as far as therapies go. With the oncology side of things, it's basically cut and dry up here in Manitoba anyways about protocols, and there's no room for improvement. If someone is very sensitive to therapies, for instance, there's no leeway in that in standard care. However, here we like to work with patients, their sensitivities, what they prefer, and these kinds of things to come up with a treatment plan together. Today we're going to talk about brain cancer. And brain cancer is a very, very important one to have alternative cancer treatments paired or on its own, as you'll see some patients who have done quite well with even the naturopathic treatments on their own. If they're paired with radiation and with a chemotherapy, it tends to do better for many, many, many patients. So our therapies here were geared towards not interfering with anything that's done as far as standard care, and also enhancing the quality of life, the immune system, and the chances for living long, and also for living with the quality of life that's necessary. So today we'll go over a few cases that we've treated here, actually 4 of them, and we'll discuss a little bit about their details and how things have worked out for them. I hope you enjoy the presentation. I'd like to tell you about the first case, and this is a glioblastoma multiforme case, which is a brain cancer that's very aggressive. So this one has a short life expectancy that's about 9 months. So anything that patients can do to enhance longevity, enhance their well-being, and enhance their time with their loved ones and their quality of life here. We don't mention cures here. We mention that we're going to help patients, hopefully, to get better for longer. This case is a 62-year-old male who came in. He experienced the first signs of his glioblastoma with a seizure that he had. They went in pretty soon after that, did some imaging, and found that there was a tumor there. MRIs are usually done. MRIs are safer than CT scans. CT scans put a little bit of radiation into the mix, and we don't want that with any of our cancer patients. So MRIs are preferred for imaging some of the brain cancers like this. Once they did the imaging, they decided that they were going to go ahead with treatment. Now, a standard treatment for glioblastoma patients is using what's called temozolomide, which is an oral chemo agent, as well as radiation. Now, even with these therapies, the prognosis, or how long patients tend to survive, is just 6 to 12 months, and that's such a short time. So we worked with this patient, and we achieved to get him over 2 years and really healthy between that period of time. The nice thing about the naturopathic therapies, and I can't mention them specifically due to Health Canada regulations, but I will tell you our protocols that we've worked with brain cancer to improve them over the years, and have come up with a great protocol for our patients. This particular patient had radiation and chemotherapy, which was the temozolomide, and he suffered quite severe side effects from it, unfortunately. And this is another protocol that we use with naturopathic medicine to help with the side effects, not only to make the radiation and the chemotherapy more effective and not interfere, but also to help with the side effects, so patients can go through with standard treatments if that's what they choose. Some patients have to go off of chemotherapy, which this patient did because of his severe nausea, his severe vomiting. And unfortunately, what happens with that particular treatment, that chemotherapy for this particular brain cancer called temozolomide, it causes what's called marrow suppression. Then the bone marrow makes red blood cells and makes white blood cells. The cancer team will follow that to see how low things get. If you suffer from really low blood counts, you can't continue on the chemotherapy. it's just knocking it out. And that's exactly what happened. On top of other symptoms, he also got high blood pressure during this whole thing. So we manage everything individually for the patient. We manage all these side effects that he might be experiencing, along with moving ahead with our cancer therapies. So the therapies, I can't go into detail and I can't tell you specifically what they are due to Health Canada regulations. However, we were able to hold him on for much longer than his prognosis. So like I said, only 2% of patients with this particular brain cancer called GBM or glioblastoma multiforme live for 3 years. That's a small percentage, and that's even with the cancer treatments that are usually prescribed, chemo and radiation. So he lived well over 2 years, and that's quite a significant thing for a patient with this kind of prognosis. He did well, his immune system was up, his blood counts started to improve, and he had to go off of chemotherapy for a period of time. We monitored him using the MRI scans, and during the period of treatment for about 6 months or so, where he was receiving just naturopathic treatment alone, the MRIs showed that he was stabilized just on these treatments alone. So working in conjunction with oncology treatments is what we do, as well as sometimes when patients aren't able to do chemo because of the side effects and the stoppage of it from the oncology side. We pride ourselves on working together to get the patient's health as maximal as possible. With brain cancers, particularly GBM, this is very difficult, and it commands that a strong team work together to achieve the results that we have, in particular with this patient. And further to this case, we also tested heavy metal and also chemical exposure for patients, which is not done in standard oncology. We want to see if there's anything behind the cancer that might be stimulating cancer growth, and that's finding those elements in the system that might be contributing to further cancer, and that's called carcinogens. We do heavy metal testing as well as chemical testing in the blood to see if there's anything that may be a problem with patients. In this particular patient with glioblastoma, he had very high lead as well as mercury and cadmium in the system, and aluminum as well. These are all contributors, and we know that they're known carcinogens. As well as he had benzene and xylene in the system as well, which are two chemicals that can be picked up from the environment. Remember, environment is very, very important to cancer, in that 90% of cancers are environmentally related and only 10% are due to the genes. So gene testing is a new modality in oncology treatment. However, it doesn't necessarily translate into what the cause is. Very, very often, 90% of the time, is the environment. So we like to investigate first of all, and then detoxify properly. We call it specific detoxification. Coffee enemas are very, very popular. However, they don't hit elements such as lead, mercury, or aluminum. So as we were treating with this patient, this 62-year-old patient, we also were chelating and moving things out of the system, moving heavy metals out through the urine and bringing down the burden of the toxic load that can make cancer accelerate and get worse. It's a very, very important aspect to all of our cancer patients, and particularly brain cancers seem to be susceptible to this kind of toxicity. And this is one of our fortes here, is doing the proper detoxification and effective detoxification, measuring before and after treatment to see that we've gotten rid and have eliminated some of these toxins. So let's take a look at case number 2. This is a 42-year-old patient, female, who was diagnosed with meningioma. And this case is interesting because it starts off with during pregnancy, and she had some headaches and some neck pain. And of course, when you're going through pregnancy, everything relates back to it. So it was just written off as something that might happen during the course of her pregnancy. She finally delivered, and by the time of delivery of her baby, she actually started to have lid droop on this eye. So unfortunately, what happened, it continued after her delivery. And so things didn't, her GP had said, well, this has to do with your pregnancy. And then afterwards, it seemed like it wasn't. So they did some imaging to see what was going on there, and they did find an active tumor there. Now, meningiomas and her grades are the degree of strength of the tumor individually. So there's grades and there's stages. With brain cancers, all the brain cancers tend to stay within the brain, so they don't tend to move. With almost the majority of other cancers, whether whether it's breast or whether it's lung or whether it's colorectal, we're always looking at it possibly moving somewhere else, which we want to stop. This type of cancer, the brain cancers, tend to stay in the brain and they don't tend to move. So we call them grades. So her grade was a higher grade and it's an aggressive cancer. So her prognosis is about 12.8 months, which isn't that long at all. So the standard course for her at that time was to do radiation to the brain. So she had radiation done, and they do MRI scans usually within 2 to 3 months afterwards, or possibly sooner. She had an MRI done after her radiation treatment, which showed that the tumor had actually progressed, that the radiation didn't help. The treatments that were offered, she didn't really want, and she wanted to pursue naturopathic treatments and came here to the center. So we delivered for her a couple times a week naturopathic treatments, which I can't go into detail due to regulations. And we were able to stabilize her on naturopathic treatments alone. So she stayed and was with us for a good long time after her prognosis. She actually, since her diagnosis, she lived 7 years beyond. And that's 6 years longer with family and with friends and a good quality of life. The nice thing about the naturopathic therapies is that they do not hamper the quality of life like radiation or chemotherapy can. Radiation has a particular side effect of fatigue, which happens usually about 10 days in treatment. And energy levels can be about 2 or 3 typically for patients of ours. We've seen hundreds and hundreds of cancer patients, and their levels tend to drop down, as well as blood levels tend to come down of red blood cells, white blood cells, especially with chemotherapy added to that. And that can really hamper quality of life. If you're struggling through fatigue and that kind of thing, it's not a good thing. Nice thing about the naturopathic therapies is that they tend to enhance the quality of life. That is, the immune system doesn't come down. In fact, the immune system can be enhanced by the protocols that we deliver. And the protocols that we deliver are very specific for each patient. So we can, if patients are suffering from fatigue, we can add things into their protocol in order to bring them up. So this patient did pass away. However, she did live a long time beyond her prognosis, and we're glad to say that she's quite a success as far as treatments go and as far as her survivability goes. This is a short case. This is a central nervous system lymphoma, which is a different, unique kind of brain cancer. And it's a 70-year-old patient, wonderful patient. And she had gone through her treatments, her standard treatments of rituximab, which is a monoclonal antibody. This is new therapies or newer therapies that are used along with chemotherapy. Monoclonal antibody therapies target specific flags that are found on certain tumors that have to do with the immune system, and by targeting that, hopefully we can get some tumor reduction. She's on the rituximab, as well as she's on a high chemotherapy of methotrexate. The methotrexate is sometimes used this way for cases like this. However, she was suffering side effects from both of these together, and both of them can be quite limiting as far as the red blood cells, white blood cells, fatigue, nausea, vomiting. These are often side effects. The expectancy is that she probably will not improve with these therapies. However, we did add naturopathic therapies in with the protocol that she was given, which I can't go into detail because of Health Canada regulations, so I can't give you the specifics on it, but our protocols work together with things like rituximab and with methotrexate to help to enhance the therapies and to help provide so that there's not so much side effects. Patient did very, very well, and actually the oncologist was quite excited to tell her on her follow-up MRI that she had, that he said whatever was there is gone. So essentially the tumors had disappeared. She had a number that were up in the brain casing. We eventually got rid of them, and that was quite an accomplishment to do that. Now, it's very important that you have an experienced naturopathic doctor on board, because not all medicines get through to the brain, and it's important to have someone on board who has a lot of experience using naturopathic medicines to make sure that the therapies that patients are getting for their cancers are actually getting to where they need to go. And that's what our focus is here, to help patients with different cancers. And this cancer is a unique one, the lymphoma of the central nervous system in the brain. And we work with all kinds and all types of cancers. This is a 63-year-old case. It's a renal cell carcinoma, so kidney cancer that has metastasized to the brain. Now, unfortunately, she had that happen. Only 10% of the kidney cancers actually move to the brain, but the brain is kind of a common site for cancers to move to for whatever reason, as well as breast cancer can move there fairly commonly as well. So she had the metastasis to the brain. Now, brain cancers, as we define them, can be primary. That means that tumors can happen there first in the brain and tend to stay in the brain case. However, this is called a secondary cancer or metastasis, where this one has moved there. So only 10% of kidney cancers turn into this, and unfortunately she had this happen to her. So during the course of her treatment, she had some gamma knife surgery that was done, and that was done 3 times over the course of a year. Gamma knife surgery is a very good kind of surgery in which the gamma radiation is applied very specifically to the brain without having to do any surgery. And so it can be quite a great therapy. After the therapy, she didn't have treatment, and she came in for naturopathic assessment and for a naturopathic protocol. And we've treated lots of brain cancers and lots of brain cancers with metastasis. And we worked on a protocol together with her input as well. And what we came up with was treatments here at our center, and we can't go into detail on them, and we can't explain exactly what they were due to Health Canada regulations, I'm afraid, and I'm sorry about that. And also worked on diet as well with her, which we do with all of our cancer patients. Diet does not cure cancers as you might find online, but cancer therapies, including the diet, are very important overall to maintain health, to make sure that there's not foods in there that is causing the cancers to grow. And we go over diet as well as our therapy. So undergoing therapies is something that can be evaluated using an MRI scan of the brain. As it turns out, with the naturopathic therapies alone that she had undergone for about a year or so without any other treatments, we were able to actually have it such that there was just a residual small tumor left and that the others had basically gone on the following MRI. Now, this is no guarantee. None of these cases are guaranteed to have these effects with any of the therapies involved, including ours. However, these cases are important to note that the naturopathic side of the treatments can be very, very, very helpful for patients. She continues to get her therapies done, and she's healthy 3 years after her treatment started, and she has just a 10-month from the initial prognosis, and she's surpassed that nicely and continues to be happy and healthy, and we enjoy seeing her each time here at the clinic. Thanks for joining us for that presentation. If you have any more questions or are interested in the therapies, please go to www.drcaesar.com, so that's drceaser.com, to get more information. And also there's a contact form there if you wish to get a hold of us. Thanks for joining us in this presentation. I hope that helped you a lot.